guys aren't there forever.
Good morning. Hey, everyone. You found it. Thanks a lot for making the switch and the trek. Hopefully it was better for some or not any worse. It was surprisingly quick for me to get here, so I was pleased. And so you may have already noticed, for those of you in this room, that this is a pretty high-tech setup that we have here. So we're still getting used to it. Literally, we're trying to connect to another site right now in Vernal. But I think, and I can't see anybody, but I think we might be connected to, who is our other site? Orem. And we may have someone in Orem connected to us right now. If you, Jeanette, are you able to hear me? Are you in the Orem classroom? All right, well, we'll figure that out. But anyway, thank you very much for those of you who are here in the room. And I know we have a number of people on GoToMeeting. So why don't we go ahead and start with our introductions. Let me move the slide along. This will be our agenda today. And we'll start with our introductions. So I'm Mindy Tueller, and I manage the Medical Home Portal, and I facilitate this meeting. Oh, I see you. Hello. Hi, is that Orem? Not hearing anything, but
That is Vernal.
That's Vernal. Oh, fantastic. Okay. Great, great. Okay, so we're connected to Vernal. Very good. And maybe we'll get Orem. Okay, this is exciting. All right. So yeah, if I seem like I'm not sure where to focus, it's because I'm not really sure where to focus. I'll get used to it. Okay, so Mindy Tueller, and let's see, we'll go ahead and start with Dawn, if that's okay.
Yeah, I'm Dawn Bentley. I'm one of the quality improvement coaches with UPIC.
I don't know. Do we, Brigham? Should we have folks use the little? I can't quite remember what these the clickers.
Yeah.
Are they for? They improve the audio.
If you hit A on the clicker, it'll unmute the mics. One?
A.
Or one, yeah. Sorry.
Oh, one. One unmutes, and then do they need to press it again?
So they just hold it while they talk.
Oh, hold it while you talk. Okay, press one and hold while you talk. Okay, yeah, go ahead.
Hi, I'm Dawn Bentley. I'm a quality improvement coach with UPIC.
So you gotta point it at the speakers.
Where are the speakers?
The speakers, see that red
Can you hear me?
Oh. Yes.
Yeah.
We can.
Thank you. That's all. Sorry, y'all.
We'll get right back with you.
Okay.
Oh, okay. So they switched it, so you just have to press it now. So they're on now.
Okay, if they're green, they're on.
So if it's green in the ceiling, it's off.
And so you don't need to press.
Yeah, we're good.
Oh, good. Just talk.
Hey, I'm Christina, care coordinator for University Pediatrics.
I'm Tony Estrada with Integrated Services.
Heather Carlson, Integrated Services Program.
Rose Select Healthcare Manager.
Eric.
Oh,
Sorry.
So actually,
Oh, I see what. Okay.
I think you don't have to
Eric
touch it at all.
Christensen, who cannot be taught. Number one. Number two. I'm with Utah Department of Health Integrated Services Program.
Taurus Integrated Services Program also.
Greg Hawks with James Mason Centers for Recovery.
Welcome. Welcome.
Thank you.
Okay.
Chuck Norland, Director of the Medical Home Portal.
I'm Heather Adams, a parent consultant with the Early Hearing Detection Intervention Program, and my daughter Hannah is with me today.
Welcome.
I'm Jan Boker. I'm the care manager at Memorial Pediatrics.
How are you?
Katie McClure, the nurse manager at Intermountain Currents.
Gina Polameni, Utah Family Voices.
Tay Haynes with resources on the Medical Home Portal.
I'm Heidi Bates. I'm with, the University of Utah Redwood Clinic.
Great. I'm sorry to put you guys on the spot, but if you don't mind, would you introduce yourselves?
Yeah, I'm McKenna at Southridge Pediatrics. I'm the nurse care manager.
I'm Carly. I'm Southern Pediatrics and the care.
Excellent. Okay. And then we have a few people, I think, on GoToMeeting. So if you are unable to have a mic to talk, you can maybe type in the chat box and we'll repeat it for you, or you can let us know that you're joining us.
This is Kristen from Vernal, and I am one of the Nurses at the Tri-County Health Department. I'm the care coordinator over the CSHCN program.
Welcome, Kristen. We're really glad that you're taking advantage of this new setup we've got.
Thank you.
This is Deborah Watkins from Shriners Hospital for Children here in Salt Lake City. I'm the Director of Care Management and Outpatient Clinic here.
Hi, Deborah. Welcome.
We also have
Thank you.
Carl Vincent from.
This is Neva Stevenson. Can you hear me?
We can.
Great. I'm from Shriners as well, physician liaison. Happy to be with you.
Terrific.
Carl Vincent is a care manager for the University of Utah for pediatrics.
Oh, great. Welcome, Carl. Heber, right. Okay. And Rachel, do you mind introducing yourself? Sorry, I catch you right as you're sitting down.
Hi, I'm Rachel. I'm a parent consultant with Utah Family Voices who works with the state entity.
Great. All right, so we've got Kristen and Vernal. We've got several folks on GoToMeeting, and I'm not sure that our Orem site seems to be connected. Yeah.
I'll work on that.
Okay, thank you. Because that was the last one that we anticipated someone doing. So. All right. Well, clearly, there'll be a little bit of a learning curve. But I mean, can you already hear the audio improvement with the GoToMeeting folks? So that's terrific. And it's great that we can actually see Kristen. Although, to be honest, Kristen, we're only catching really your eyes and upward. There we go. It's your choice, whatever you want, but just letting you know. So yeah, this is a state-of-the-art room, and it's a state-of-the-art system. Hey, Beth. And all of the USG remote sites have this connectivity ability to basically have live meetings held at the same time. So it's really pretty cool. So what we hope is that over the next few months and beyond, we'll start to reach out to pediatric practices and other organizations that are in these more remote sites, and as those locations are available, we'll have people joining us so that Kristen won't be alone, and we'll have these other locations that we'll be able to see and connect with. I anticipate that it could get very busy because they'll all show up on the one screen as they just get smaller and smaller thumbnails. So it'll be something we all have to get used to, but I think it'll be a really good thing. So. All right, so let's make sure you know a little bit more about this this building, this location in Salt Lake. How many were able to use the e-stores? So almost everybody, that's great. So if you'll have noticed, if you didn't use the e-stores, if you come in the main front doors, you kind of have to go all the way around to get to this room. So it's just a little bit faster and more straightforward to come in the e-stores and then come down this hallway. And the bathrooms are, in fact, by those e-stores. So if you need to use the bathroom, you just kind of go up this hallway, this east hallway, and then look by that, by those doors. So, great. All right. So if you need to have wireless access, I believe that this information will change every time. So I'll post this kind of information with every meeting. You do need to find the Blue Zone network and launch a web browser. Unless you're on a phone. I didn't have to do that. But launch your web browser, and then you need to choose the sponsored access option, which is there's 3 options, and I think it's the second. And then you put in your name, and then CHIWOS. I don't know the significance of that, but that is the password. And so feel free to utilize that to have Wi-Fi while you're here today. All right, so now we're going to start talking about your cases, your hurdles, anything that's going on with you that you'd like a little help from this group. So is there anybody, whether it's in Vernal, on GoToMeeting, or in this room, who has something they'd like to share with us? And this doesn't necessarily have to be anything that you're struggling with, although we certainly like to try and help with those. But if there's a win that you've had, or if there's something you'd like to update us on from a prior meeting where you were maybe struggling. Also, if you've run across a new resource, we always like to hear about that sort of a thing. So, anyone? Yeah, Tony.
So I was have a Spanish-speaking family from Provo. It's a family of 4, the mother, the dad, and 2 sons. The boys are, one is 12 years old, one is 26 years old. The 12-year-old is severe nonverbal autism. The 26-year-old high functioning. He went through school, graduated, and stuff like that. So when I first spoke with her, she got our number from Help Me Grow. She was calling around to get some help for her family. So her husband is disabled. He's getting Social Security disability. She's getting Social Security disability for the 12-year-old as well. She doesn't work because she has to take care of the husband and the two boys. The 26-year-old, it made me really sad for him because she said that he hasn't bathed for 2 years. Doesn't leave the house. Doesn't want to do anything. He just kind of basically has given up. The 12-year-old, he was in school, but he's allergic to everything, literally. So mom has pulled him out of school. He hasn't been to school for probably 5 months now. So I'm just wondering, anything for this family? I mean, like, nobody leaves the house. Nobody goes anywhere.
Right.
Spanish speaking, they're just, living day by day.
You called family resource facilitator, huh?
Yes, and there was like they said about a 3 to 4 month wait.
Can you say that again a little louder?
I called for a family resource facilitator to go to the home, and there was about a 3 to 4 month
Really?
wait. I haven't.
Heather, do you want to say that a little louder?
I'm sorry. I was just wondering about home and hospital for the kiddo that's with allergies at home. Please get through the school and have the teacher come. They'll come a couple times a week.
Okay.
That kind of stuff through the school district. It might be worth setting up some kind of meeting, IEP meeting or something, and trying to get some people in the community and through the school, and maybe they're going to have to go to the family's home or something. And Gina's group would be awesome to go in there as well. Maybe just kind of have a little brainstorming session meeting.
So also I just remembered the 26-year-old, he will not go to the doctor. So she has tried to get him out to like therapy or something, and he just refuses to leave the house. So that's why I was thinking family resource facilitator, somebody that can come into the home.
Right, right.
So did the family resource facilitator follow up?
There's a 3 to 4 month wait list.
Wait time, okay.
Okay, so they're allies with families. So we had a family resource facilitator. Lost her, but they're trying to hire right now, and we can see if maybe we can help get in. But so home, hospital, all of those things we need to, if he's on a current IEP, because they only come out once a week usually. But there's some other creative ideas to try to see if we can get him, the curriculum and all of that. And we could even do some online, and then maybe have some, specific, even if they have home hospital, to check and look at some of the related services that may be provided because of the allergies and such. And then so we can work on the family resource facilitator, because that would be the perfect situation. Or if we can't get one, we'll have family voices that step in for a short time. The 26-year-old, if they thought about doing maybe Connect Care to start off with, or some type of
telehealth.
Telehealth to just to start.
I don't know if they have a computer at home, so I'll need to check on that.
Okay.
But maybe even a smartphone, right?
Yeah. So kind of looking at some of the out-of-the-box ideas to at least get that started and get him maybe in a trusting relationship with a provider that he may be willing just to go to that one to start with.
And there also are a few that do kind of that telehealth, but it's on the therapeutic side. So you could also look at a therapist who can connect over the phone or, video conference, something like that, that might be able to do a little bit of like some outpatient therapy with the 26-year-old. Where do they live? What city?
Provo.
Provo, okay.
Do you know if they have any sort of community support, any religious affiliation, any sort of that sort of thing?
Yeah, no, they don't.
Okay.
BYU does have a service organization there. It's not based on religion, so you might want to give them a call. And sometimes they're like, there's students that are in their education program have to put in X amount of volunteer hours. And so that might be another source. I'd give them a call.
So what is it?
It's a service organization, and my mind has gone brain dead, but they came up and painted my parents' home years ago, just because they could. And so I just don't remember, the name of them, but if you just call BYU, it'll come up.
Okay.
I don't
Yeah.
think you're sharing your screen.
Oh, that would help.
And it looks like we've got somebody new on the.
I know. I think that's great.
I think that's, yeah, because they changed the name. I think that's it.
There you go.
Okay. Great.
Well, that one you signed up to actually do service, but there's an organization through BYU.
Oh,
There's both.
there's this, it says YServe on it, the Center for Service and Learning. I don't know.
Oh, I remember YServe. Yeah, that's right. We've got it in the portal. I can, for the life of me, not see the mouse, not see the cursor on the screen. There we go. YServe Access? Yeah, it looks like we have a number of them right here. Okay, that's a great idea, Pat. Thank you.
Could you make the screen a little bit?
A little bit bigger? Does that help?
One more time.
One more time.
That's good.
Yeah, we can look through these and see if we can identify the one, because there's a number of these programs, these YServe programs. This might be the one that painted your...
Well, I know that the YServe is if you want to do community.
Okay.
But BYU has an organization within the university.
Okay.
But this might be a place to get started.
Yeah, okay. We can follow up on that. That's a tough situation. The Family Resource Facilitator. We'll see if we can focus on that. Okay. So I think we may have another USU site connected. Is that, Brigham, is that the Orem site? Yes. This doesn't seem like there's anyone in it, but yeah, that's not your fault. So that's great that we can see another site. That's fabulous. So Kristen, this is kind of what we do at the beginning of each of these meetings is we try and provide some of that sort of crowdsourced support. So it's helpful to identify resources for whomever, whatever care coordinator or care manager type person is trying to identify those, and also just to draw on the experience that our other folks in the room have had with something perhaps similar. So if you ever run into something that you're having trouble with, this is a great place to bring it. People will do their very best to help, and we don't just let it end after the meeting. We continue to try and work with that, and we can also help in between meetings. It's not something that has to wait. So we have a listserv that you're a part of now, and if you have an issue, and I want to remind everyone about that too, you can email that listserv, and we can crowdsource in between meetings. So we're always happy to do that. And then the last thing is, if you've gone through that process of answering our brief questions and saying that you give us permission to publish your information in our shared directory, then you have the ability to see others who've done the same and get in touch with them one-on-one, so that you don't have to feel like you have to send emails to the entire list if for whatever reason you don't want to. So a couple of ways to do this. Okay, well, I hope that helps, Tony, and it sounds like Gina might have some things to help follow up with more specifically, and we'll continue to look as well in the Medical Home Portal and then send that out, okay? All right.
I do have one more.
Oh, okay, Tony's got another one.
It's just kind of an update on a family. I don't know if a few months ago I spoke about a homeless mom with a little boy that was autistic.
Yes.
They just moved into their new apartment yesterday.
Oh.
So they got into a brand new building called the Bodie Complex.
Okay.
And it's through Section 8. It's not just for low-income families. They're kind of integrating
Good.
all walks of life, I guess.
Excellent.
And so they just moved in yesterday, and they had a little bit of a hiccup with their inspection. She was supposed to move in a couple of weeks ago, but they were able to somehow get her and another homeless woman to be moved in yesterday. They're the only two, and everybody else waits 2 more weeks.
Oh my. Okay.
So they have a little chance to kind of get used to it, and
wow.
She's super excited. She just kept crying yesterday. She couldn't stop crying. Just saying it was a dream, and she has her own washer and dryer.
Oh my gosh.
And the 2 bedrooms, and the bedrooms are huge, and she was just.
I bet.
I just keep wanting somebody to pinch me. I can't believe it's just a dream.
I think that's such a success story, and that housing, and we know how difficult housing is in Utah and Salt Lake
And it's
specifically.
so close to the bus and bus stops and stores, and she's like, it was just everything that she could have ever asked for.
And is it in Salt Lake? Okay. Wow. And
The
did
thing
you?
with this is too a lot of tenacity for that mom to make this happen. But Tony, she was saying, "Hey, I'll be in Salt Lake." I mean, Tony works out of Ogden. She's come to Salt Lake multiple times to meet with this mom and help this mom. So Tony's been just an incredible advocate.
That's wonderful.
And helper for this mom. So shout out to you, Tony, for great work.
Wonderful. Oh, that's great. So it gives them a foundation where they can start to see other successes for that child.
And so her son will begin to receive ABA.
Wonderful.
Therapy soon. So.
And how old is he again? Is he about 6?
He's 6. Going to be 7 soon, yeah.
Good. Oh, that's great. Thank you for the update. Great. Anybody else? Pat?
I have a question.
Okay.
I have a 6-year-old who has a seizure disorder that's getting harder to control. The Utah Epilepsy Foundation can provide a SAMI device. It's like a monitor to watch her at night while she sleeps. She needs to go get counseling, but I can't get her to do that. Anyway, the SAMI device won't work in this mom's apartment complex because she has to pay for Wi-Fi. And for her, that's an extra that she can't afford. Is there a way to get subsidized help for Wi-Fi coverage for something like this? Does anybody know anything?
Where do they live?
Ogden area, Layton.
So who provides internet up there? CenturyLink.
What about Jewish one, but UCAT.
Well, that's an interesting idea.
Yeah.
Center for Assistive Technology.
Yeah.
Okay.
And with the disability and everything, they figure it out. Yeah. They come out to the home and do an evaluation.
Does it have to be like a hardwired line, or is it just like a Wi-Fi? So could it be over like cell phone or anything like that? The question.
Well, I asked her about her cell phone because that's her mode of communication. But she said that the complex itself, there's some kind of a problem, and so I'm just trying to. I don't know. She said it's not possible. Let's put it that way.
One of those places where, everybody has to have DirecTV, or everybody has to have Comcast, or everybody has to, you have to pay a certain fee, an HOA fee or something like that. So I'll see if they do like a program or something that they give back. Because I know Comcast does a lot of charity work. Yeah,
that's a good idea.
I call them.
So who?
It's like Rocky Mountain does a thing too. A lot of charity. Yeah.
I do know there was a recent article, and I'm trying to find it, that like the cell phone service and such, they come out with one for Wi-Fi. It's very limited, but and it was advertised not too long ago. So we'll see if I can find it. But I was just telling how they're UCAT definitely can help with if there's looking at any maybe equipment equipment, but it would not pay for any service at all. That's not what they're.
So
but
they have the device. It won't work in her comp.
So, but to pay for it, we could go through Able differently and apply for those program funds. I mean, I think the Comcast idea and seeing the charity work to me sounds like the quickest, easiest way to do it. But if you had to do it in steps, you could maybe combine UCAT and then apply for the funds to Able differently.
Okay.
School foundation. Yeah, I wondered about the school funds too.
Yeah, it just depends if they're Davis or Weaver. If they're Weaver,
If they're in Ogden, I'm pretty sure they're Weaver. Davis
Oh, then they're south of Ogden. So
if they're Weaver School District, we could go through the
If they're
Weaver School
Riverdale, I mean,
Foundation.
they're still, or
But if-
Roy, they're still Weaver.
But if they're in the Dayton or the Davis County, we'd have to, if they have a foundation like the Ogden schools, so because both the school districts have foundations, but it's worth looking
but her school should know.
into.
Okay. All right. Thank you.
Okay, fingers crossed. All right, anybody else? Anybody on GoToMeeting? All right. Well, with that, we'll turn it over to our first presenter, Joy Stolkort. Let's get back to the slides. And welcome. So we're getting used to a new setup here, and I don't really have any slides for you.
Pull up their website.
Yes, we can. Yeah, for sure. So anything I can do to help, I'll just be sort of in the wings over here, okay?
Right, so let's bring up the website.
Okay, so if you want to just type, I think it's really hard to see that. Yeah, it's there. Yeah, you can just start typing. The cursor is in there. So.
Okay. Don't see the
Yeah.
cursor.
Oh, it went away. It was right there. Yeah, I know, it's really hard. Let me see if I can get that for you. There we go. Okay, so yeah, if you just start typing, it's up there. Yeah. Oh, and I think I need you to have the mic on. If you don't mind, and if you don't want to do it,
Oh, I'm
that's fine
happy
too.
to. Let me just get this up here.
And I might make that screen just a little bit larger.
Okay. All right. So you're gonna have to give me some technical instruction here.
Okay.
Is that gonna work?
That looks good.
All right. So do I hold this, carry it? What do I do?
You can set it down. If you have a way to kind of attach it to a pocket, that might work better. It's got a little latch there.
Not really.
Okay. So
Okay.
let's see how it goes. And if you like to walk and it's not going to work, then we'll get rid of it.
Well, okay.
Okay.
Can you hear me though, or?
Oh yeah, I think everyone's.
All right.
For whatever reason, those are off. I'm not sure if that's a problem. It's not if our presenter's the only ones talking. Okay.
Okay. So I'm obviously relatively short and hidden by the screen, so I'm going to have to move a little bit. I'm Joy Stolkort, and I'm with the Legislative Coalition for People with Disabilities. I don't know how many of you are familiar with the coalition. We've been around since the early 80s. It originally was a grant project of what was then the Governor's Council for People with Disabilities. It's now known as the Utah Developmental Disabilities Council. And the Legislative Coalition is a volunteer organization. It's made up of families. It's made up of agencies and organizations and individuals with disability. And we spend an inordinate amount of time in community meetings, in community meetings with, and then state agency meetings, and then we're up at the legislature. So we follow the goings on at the legislature year round. I'm sure most of you realize that the legislative session, while it's only 45 days
from the end of January to the middle of March. That's not the entire process. That the legislature meets throughout the year. They meet in what's called interim on the third Wednesday of each month. And it's during that time that many of the issues that we're interested in get more intensive study. So what I intend to do today is to go over what happened during the 45-day legislative session. Is there some way to enlarge our screen so people can maybe see a page at a time? Just a bit about myself. I came to the disabilities environment when my son Cameron was born 36 years ago. He has a rare genetic disorder called Freeman-Sheldon syndrome, and I ran a support group for the syndrome for about 28 years. When he purchased his condominium, I decided he was an adult and it was time for me to move on. And it turned out that there was a young woman in the support group who was willing and able to take on administering the group. And frankly, with Facebook and all of social media, it continues to grow. When I left it, we had a membership of about 350 people worldwide. So it's a real rare condition. Okay, getting back to the report. I'm sure that many of you use the services of the Division of Services for People with Disabilities. They're the ones who cover the waivers for people with intellectual disability, physical disability, and traumatic brain injury. And there were a couple of issues that were directed towards them this year. The first one on our report is HB 109. You know that the division has a huge waiting list for people who are wanting to enter into their services. There are about 2,700 people who are on the waiting list. And a few years ago, there was a decision made between Senator Christensen and then Representative Menlove to divide any new allocations of money so that 85% of new allocation would go towards those who were most critical and 15% would go to those who needed only respite care. Representative Ward, who sponsored HB 109, decided this year that he was really not in favor of that allocation, that he wanted to see that only the most critical were being served first. And so he sponsored this piece of legislation that would have reverted back to only serving the most critical. And the reason that this would have been important to the community is that many people who have come off the waiting list in the last few years have come off through the respite only aspect. So because we realized that this was going to be a major change to the way money was going to be allocated and the number of people who could be served, we were able to talk Representative Ward into putting off any decision, and this item is now going to be considered during this interim period between May and November. And according to the list of study topics that was just released yesterday, it is one of the items that the legislature may decide to study during interim. It would be during social services appropriations. So let's move on. Let's look at what they actually got. So if you look under this allocation portion, you'll see that the Division of Services for People with Disabilities was awarded funding for another for direct care staff salary increase. This has been a real problem. 5 years ago, the legislature decided that it was going to address the critical, salaries for direct care staff serving people who were on the waivers. People were getting minimum wage, $7.25 an hour was the starting wage. And the There's a person back there. Anyway, starting salary was at minimum wage, and turnover was 94%. Well, you can't run a business with a turnover of 94%. It's not good for your business, and it's certainly not good for people with disabilities. So the legislature decided that it would work with the provider agencies, and they developed a plan where over a course of 3 years, they would bring the wage up to $11 an hour. So for the first year, they allocated $3 million. The second year, they allocated $1.5 million. The third year, they allocated $1.5 million. And then they were going to finally make up the difference this year. Well, they didn't. So we're still working to get up to the $11 an hour, but it has made a difference. The turnover rate is now 54% a year, which is still horrendous, but at least it's a more attractive wage for some people. And it's caused a real issue in terms of training. How do you provide training to someone when they're going to be leaving in a very short while? I mean, anytime there was the opportunity to find a job with greater pay, whether it was even 25 cents, somebody would move on. So this is a step forward. Eventually, we hope that we'll get to the $11 an hour, which is still going to be too low because we all know that some of the fast food agencies are paying $11 now. One of the other issues that the agency got was transportation funding. This is critical because they provide transportation to and from their programs as well as to activities in the community. Another allocation was for youth who are aging out of services. Let me restate this. There are people who get services from DSPD who are actually under the auspices of the Division of Child and Family Services or Juvenile Justice Services. And as long as they are under the age of 18, DCFS and JJS pay for their services, but the services are delivered through the Division of Services for People with Disabilities. And the Division of Services for People with Disabilities can't absorb their costs once they age out of the other agencies. So this is additional money that they receive to continue their services. And then they got $2 million towards the waiting list, which is terrific, and we're excited because that means that some people, they're estimating 300 people, will be able to come off the waiting list. But that goes back to the salary issue. And will providers be able to hire enough people to provide services to this group? There's families also can hire, but again, the wage has to be attractive enough to get people who are willing to work with the population. The legislature then did something that's called intent language, which means that they want to take a more careful look at the way things are being run. And there's some very extensive intent language for the Division of Services for People with Disabilities. One of them is around expectations of transition from school to work. The expectation is that kids who are coming out of school will have the training so that they'll be able to be in non-segregated work. They're trying to, if not eliminate, restructure the way some of the work sites are going to be operating. I don't know if any of you have heard about the settings rule. Have any of you heard about the settings rule? Yay, Gina's heard about the settings rule. All right, so the crux of the deal is that the settings rule says that people with disabilities need to be served in the least restricted environment that provides integration into the community, which means that for many folks who are in sheltered workshops, there is the possibility that sheltered workshops will be closed. And that's going to be huge when it comes to serving some of the folks who DSPD provides services to. And so they're looking at other ways of providing services to this group so that they will be more fully integrated at a competitive wage. And that's a biggie, competitive wage, because sheltered workshops have paid very little. So the legislature wants the Division of Services for People with Disabilities and Education and Workforce Services to come together and come up with some sort of plan that's going to address this settings rule. They also want them to take a look at the waiting list so that they know the real need and the cost. And the Division of Services for People with Disability are holding some focus groups. They're starting now. They're going to hold focus groups in May, and then they'll be doing research all summer. They're going to put together their report in August. The focus groups will again meet, and then they'll be presenting to the legislature in October. All right, so that's what we had for the Division of Services for People with Disabilities. Are there any questions on that particular agency? Let's move on to substance abuse and mental health. So I think the takeaway for substance abuse and mental health is that there's been quite a bit of emphasis on crisis and suicide prevention, and there was money that was given to those particular aspects of the program, and that ought to provide better access for kids with disability. There's, let's see, there's HB 308, which is a pilot program that Representative Ivory did that is going to perhaps provide better access to mental health services in the schools for kids with disability. And then HB 370 is going to provide more funding for suicide prevention in schools. And I don't know if this one is going to be of particular interest to you or not, but Senate Concurrent Resolution 11, Awareness and Treatment of Maternal Depression and Anxiety. I know that there has been some interest, at least in some pediatric practices, to be able to screen moms for depression. And this was a resolution to at least bring some more attention to the issue. You'll notice in the appropriations section that the Children's Center, which provides mental health services, received an ongoing appropriation. Okay, so the biggie for kids with special needs this year was HB 100. Many of you know that there has been a waiver for medically complex children, and it was a pilot program, and it is now going to be an ongoing program. However, the funding for it really did not provide for any additional slots. And then HB, yeah.
So no additional slots at this time.
Mm-hmm.
Do they have plans for open enrollment anytime soon?
Not that I'm aware
No,
of.
they do not.
Okay.
Not that I am aware of.
So there is a current work group going on, and they're going to relook at, there's a couple of us involved at the state level, looking at who's on there currently, making sure that they all met because we do know that they had enough slots that they were really, trying to work through, because it was a heck of a lot of kids at the same time. Really looking at those criterias again, and sorry, I'll come that way because you guys' necks are to make sure that the three systems are involved, and that this waivers truly meet or has the children on there that it was truly meant for. So there's a few tweaks going on. There's not a lot of spots being opened up. on this particular waiver, which is good. That means, because usually that means that they're aging out, but the average age right now is actually fairly young, so it's going to be a while. And luckily, we don't have very many passing away, because that would open up slots. And so once that they get that kind of known and where they're going, they'll probably do an open enrollment. But the Medicaid really wants everybody to know, because I guess traditionally we've always had that open enrollment in May, and there's a buzz going around, and they're working as fast as they can, but for CMS and the intent language and what Representative Red wanted as he was going out, there's some definite tweaks that need to be made. So we're just glad that the legislature decided to make it an ongoing program instead of just ending.
Yeah. Gina, is there anything that we as a group can do to help or support or
advocate?
Right now, we have some great. Michelle Hoffman's been involved in looking at some of the things to kind of match it with comprehensive care and such, and really look at those medical aspects and such. The family and the social determinants of health do come into play, but really, and that's where some of them were weighted more on the social determinants of health versus the medical complexity, and that's what they're trying to work through right now. So advocacy, and I'm hoping Joyce will get to that. As far as if you have things that you're thinking of, how do I advocate for, how do I even bring attention to it, Legislative Coalition for People with Disabilities really is the source to go to start that process in a way that it brings the whole community together to work on those issues.
So let me call your attention to just a few more things that happened at the legislature, and then we can get into some of the advocacy piece. There was HB 325, which I don't know how many of your parents might be on the primary care network, but it's a very, very limited benefit. And what this bill did was to say, let's expand services to the group so that they would receive everything within the Medicaid package except for long-term care or maternity coverage. The only thing is that they are deferring this because there was another piece of legislation HB 472, which is the Medicaid expansion that the legislature passed. And this Medicaid expansion would go up to 100% of poverty. It must be approved by the feds, but the catch here is that they want to do the expansion at the 90-10 match. Are all of you familiar with federal match? Okay, so the federal government right now, Utah puts in 30% of the dollars and the federal government comes back with 70%. And under the Affordable Care Act, if a state wanted to expand its Medicaid program, the feds were willing to provide 90% of the cost if the state would put up 10%. But the state had to go up to 138% of poverty. Utah is saying we want to expand, but we only want to expand to 100%, and yet we want the more favorable match rate. So whether or not this current administration will approve this waiver is in question. If it does, that would be great. This waiver would also require that there be a work requirement for those receiving the Medicaid program. So right now the waiver is being written, and it will be submitted to the Centers for Medicare and Medicaid Services by July 1, and then the feds will have a period of time to decide if they want to do the expansion. So right now, the primary care network enhanced benefit is being deferred, waiting to see if this waiver is going to be approved. And in the meantime, you probably all know that there is going to be a ballot initiative in November. Hopefully it will be on the ballot. I know that they had 165,000 signatures that they turned in on Monday. to ask the people of Utah whether or not they want to fully expand the Medicaid program up to 138% of poverty. And if that expansion were to be approved by the public, that actually would be a better deal for the state. We'd have more federal money coming in, more people would be covered, and there wouldn't be some of the caps on enrollment and the work requirement that this HB 472 has. That's my plug. You can go vote the way you want, but but I think you sense where I'm at on this. All right, let's look at some other things that might be of interest to you in terms of school. There was more funding for the Carson Smith scholarship program. I don't know if any of you are involved with that or not, but they did receive a little bit more money, and there was some clarification on kids who are deaf.
How many of you know what the Carson Smith scholarship is?
So, Carson Smith Scholarship allows a child to go to a private school. It has, I think, funding up to about $5,000, and the child is able to be served in an approved setting if the school offers something that is going to benefit their disability. Okay. All right, I think that really does cover some of the legislative things. There was one that we did not cover, but may be of interest to your families, and this was the HB 12 Family Planning Services Amendments. This will allow a woman who delivers a child under the Medicaid program to receive an IUD at the time of delivery. And this has been a problem because it was a separate, it was part of the bundled service of delivery. Hospitals were less willing to do the insertion because of the cost of the IUD, and now it will be paid separately, and presumably it will help families be able to plan their family and hopefully help them out of poverty. Okay, let's talk a little bit about advocacy. So, if you are interested in getting involved, I certainly would encourage you to join the Legislative Coalition. It's relatively easy to do. On our website, on the right-hand side of the page, you can just click on Become a Member, fill in the application. There is no charge. Our website address is lcpdut.org. But we do trainings across the state on how to advocate. The important thing is to pick your issue and then to be able to decide what level of power you need to address when you're trying to solve your problem. And knowing who represents you, knowing how to do it. And it's really not very hard. It can be intimidating, but frankly, this is a lay legislature. They need to hear from citizens. They need to hear from people like you. They need to hear from the people who you work with. And in this day and age with email and with Twitter and with Instagram, it's not that difficult to keep in touch with your legislators. Our state legislative site is absolutely fantastic. We can bring that up, I guess, if we can find the cursor. Okay. They've really done a remarkable job of providing information for citizens. You can find out who represents you by just clicking on on the tab at the bottom that says My Legislators. You can put in your address and your zip code, and you'll find out who represents you in the legislature. They actually bring up their pictures. Let me just do a quick, now you all know where I live. If I spelled it right, which I didn't.
So while Joyce is looking that up, just as part of these pieces, if you want to know, like, they'll put out what their upcoming meetings are and such. And so if it is on social services appropriations, which is where most of these pieces that affect our families and our children go through, you can also always listen to it online. And so if there's something that you want to react to, you don't have to actually be up at the Capitol to do that. And I know that's where she's going to. I'm really impressed as well as what they've done to get community involvement. And
that's not working.
The Legislative Coalition for People with Disabilities meets monthly on the first.
We meet on the first Thursday of the month. That being said, monthly is not exactly accurate. We meet. We will be meeting in May. We will probably skip June, July, and August, and then we'll reconvene in September and meet through the legislative session. And then during the legislative session itself, we meet weekly. So it gives us an opportunity to report back on what's happening, to have agency directors come and speak to us about their legislative priorities, both budget and bills. But it gives us an opportunity to build relationships with the agency directors and staff. And because we're up at the legislature year-round, we have the opportunity to build relationships with legislators. And, you know, we all know that there are hired guns who are on the Hill who are advocating for various things. But legislators really do want to hear from the people who they represent. And hearing from folks who are not paid lobbyists is very important. So, you know, if you do have issues that you want to have addressed, you can contact your legislator, or you can contact somebody from Social Services Appropriations, or from someone who serves on Health and Human Services, and ask if they would sponsor a bill for you. They may ask you to help write it. That doesn't mean that you're going to be writing it yourself. You'd be working with legislative research and general counsel to put the ideas that you have into the bill. And at the top of the page here, there are committees so that you can find the membership of the various committees. Let's just go to House Health and Human Services. You can see all the meetings that they held. You can see the members of the committee. And when you click on their names, their pictures come up, their contact information comes up. The site is really, really very friendly. But it gives you the opportunity to know when meetings are being held and what items are going to be discussed. It has the information. This morning, legislative management is meeting. Legislative management is one of these committees that's extremely important. They're the ones who set the meeting schedule for the legislature, and they determine what items the committees are going to be studying. And the list of materials for today's meeting has the list of potential study items that the legislature will cover during the interim. So, again, it gives you an opportunity to see what's happening at the legislature and to get involved. As Gina said, you can listen to the meetings in real time. You can also listen to floor debate in real time. And all of these things are archived, and you can go back and listen online at your leisure. So they've really attempted to make this as user-friendly as possible.
So, and I think the important thing to know about when we say advocacy and such, and many that work for whether state agencies or your organizations that say, well, you can't advocate. Everybody can educate, and everybody does on their own time. You're a citizen, and this is always a big misconception. And absolutely, I was even in a training at Human Services the other day where they're really letting their staff know, we want you to educate on behalf of you, the families you serve and such, especially because Division of Child and Family Services is always under fire, as well as juvenile justice. And so giving a chance of those frontline workers to say, hey, we're speaking up for our families in the case that they can't. So just wanted to just briefly touch on why some of these pieces that Joyce talked about, like the some of you got my little, I was one of those going around for Medicaid expansion, and people were saying why it passed, and Joyce said, well, it passed, and if any of you know what 100% of poverty level is, I'm not even sure our $7 to $11 an hour wage earners would still fit into that because it's so low. And there's work requirements, and we are all about, trying to make sure that we have higher expectations in school and in the community, but putting unrealistic expectations on individuals was, unfortunately. So we'll hope and see how that ballot initiative comes out. The Children's Center, of course, if you don't know what that is, serving kids, I believe, birth to 6, and is a wonderful place, but it's another one of those that kept having waiting lists and a hard time to get in. The 300 people that they took off of the waiting list, awesome. We are doing a dance, but if you get families, they're saying, hey, I got informed, but nobody's getting back to me, realize that there's going to be a bottleneck, and reassure your families to keep in touch with their workers, intake workers and such, because the division has already let us know that though they've hired even some temporary staff, it's going to take a minute to get them from, their letter saying you're accepted to actually in service. And the Parent Center and Family Voices are going to help with running these focus groups to really see what's needed from families and individuals and advocates in the community for waiting lists, or what the needs are for those families on the waiting list. And when we were talking about the high expectations in schools, really there is a shift and change. I think many have seen some of our kids, such as mine was, that has more severe disabilities, and just thinking that it was a place to kind of get them to, do whatever. And many of us have strong feelings about this. Most of the time was in the corner. There are some now, even the State Board of Education saying we want our kids to, whatever level that is, it's unique and it's individualized, but we want to support and have higher expectations. And even retraining teachers' thoughts on that is huge. Settings rule, another piece of it's some of our families are terrified of what that may do. We're hoping that, again, some of the advocates' families are on these state level committees to kind of look at that to say, hey, wait a minute, this is not all about providers and taking away the rights of families. This is really making sure that our young adults, and individuals with disabilities really get the same opportunities that everybody else does. And the last piece, that the wages for the direct care staff, that one is huge. Everybody kind of passes over because they think it's kind of this, well, no, for some of us that either have kids with autism or, you need that continuity. And, if I have a child with medical complexity, it gets to the point where you know what, the services I may have them through my waiver or whatever, I'm not going to utilize them because I'm not going to keep having to train that way, and feel comfortable leaving my child. And then, of course, with those that have, the rigid schedules and such, you can't keep bringing somebody else in. So the turnover in direct care staff has hurt many families, and even there's just not the workforce there. So we get people on waivers and we don't have anybody to help them. So all these pieces that Joyce mentioned are so vital to the families at the very grassroots. So if they're telling you things aren't working, I highly encourage you to tell them about the Legislative Coalition, because the more we can get the voices heard and such. The medically complex children's waiver actually started years ago with Joyce, myself, Chris, and Julie Beckett, which is Katie Beckett's mom, looking at information for the department. And it's been many years of getting data and such. And then we had some wonderful, family advocates really up there educating the legislators to get. So this came from not a policy perspective, not a
parents.
It came from families. And so that's why it's so important to let your family start knowing about these because that's where early intervention began too, was from families. So,
as we often say, legislators think everything is okay because they're not going to be looking for these problems. You need to let. So, any questions? I hope that you'll get involved, and it's really easy. It can be done, at your kitchen table. It can be done on your phone. There are many ways to get involved. Just do it.
Thank you very much.
Wouldn't it be amazing if we took the legislature up on their website and their ease of use, and we just flooded them with comments, and we actually attended meetings even if it was just, while they were streaming in our office, and we knew what was going on and we raised our voice about it. So that's tremendous. All right. Let's see. Okay, so how many of you guys came to the March learning session last month? See some hands. Great. Thank you. And it was a good session. It was a really good session. We had a panel of families, 6 parents who have kids with a variety of different complex and maybe not so complex chronic conditions, and then we had a panel of providers that included primary care and subspecialties and mental health, and I think we heard a lot. Yeah.
Your screen didn't change.
It didn't change. Okay. Let's see what I can do. Thank you for letting me know that.
Oh, really?
Yeah.
See if I go to that. Do you see something?
It didn't change. Sounds like it's me.
Okay. All right, well, hopefully. Okay, great. So, that's interesting. I have a little artifact on this screen for some reason. But anyway, so this is, in fact, just the same thing that we sent out as a summary. So I'm going to go over it really quickly. But if anyone who was there has a comment about it, that would be great. We'd love to hear your take on things. This was my take on things. Basically, but I think we heard a number of things that should help us to be cognizant of both what families are going through and what professionals and providers are going through as well, and if we can sort of understand what's happening on both sides, both at the very micro level and at that bigger level, then I think we can have better outcomes with everyone kind of working together. But there's a lot of information around how communication comes through, and a lot was said by the parents that right at the beginning when you're hearing things, or at important transition times, the stressful times, too much information can't be absorbed. it just can't. They're overwhelmed. They're deer in the headlights. So it's important to try and gauge how much they can take in and then give them the most important stuff and then follow that up. And that's hard. That's not an easy thing to do. It takes some management skills to be able to see those cues and then write them down and then follow up on them later. But that's what we heard families really do need. And they want the information. They want that information. They just want it at the right time. And everyone's going to be different. And then this last bullet on here was pretty important. Sometimes they do just need a listening ear. Sometimes they just need someone to just be there and hear what they're saying and know that, help them know that they are, they have someone supporting them and hearing them and validating them, really. It's important to let them know that, I think we heard from the one parent who was talking about how guilty she was feeling when she got her child's diagnosis, that somehow she had caused it. That's something that's not going to allow them to be the best parent they can be going forward if they're holding on to that. So just allowing them that soundboard. Again, this is about trying to parse out that information in little pieces at the right time and establish that relationship so that, maybe they can say, all right, well, I'm not sure what I need to do now. Maybe you told me, I didn't hear it. Can you tell me again? Certainly make sure that all information is shared with all relevant providers. A lot easier said than done, but very important. And then we definitely heard that, families all are going to have a different desired way to get back with their primary care office. So if your office allows texts or emails, that might be a better way for families. Or, Instagram. I don't know. Probably not Instagram, but... and then this was a big one. This was a really big theme. Try to include parents in the process. And we know that not every organization is set up to do this. But we also know when they're able to allow this at whatever level, right? It can be unpaid, it can be occasional, it can be more formal than that. But whenever they can do that it's going to benefit those families. It really is, because parents have that... I think they can offer a more instantaneous level of trust because they've gone through this to some degree themselves. So consider adding a parent partner to your practice. Consider creating a parent advisory committee. Next one's a little harder. Try and create a parent group if one doesn't exist. That might be a little bit too much, but perhaps that parent partner that you're working with would be a resource for something like that. And then always connect that family with the Utah Parent Center, Utah Family Voices, so that they know what else is out there and what's coming up to help them. And then, we want to make sure that parents and families understand that they need to have a voice. They need to advocate for themselves. They need to say, I didn't remember that from last time. Can you tell it to me again? I need this. Can you help me with that? That sort of thing. Let them know that they're the consumer, so they have a voice. And then help them to try and connect with the other supports that are there for them, including their insurance supports. Find out if they have care management. Wouldn't it be great if all the insurance companies could make that simple and obvious? But sometimes you got to dig for that a little bit. And it's important because those benefits will be available before it's too late or it's dire. And then ask your specialist if they have care coordination. We heard that is not always the case. But even starting that conversation can probably help, see a need and maybe get that communication going. And then make sure your families know what primary care provider means. Sometimes these terms aren't universally understood. So your family doctor, your pediatrician, make sure they understand. And then, this idea of a patient portal so that communication can be facilitated. At the University of Utah, we're using MyChart through Epic, and it's got its flaws, but it does prove to be very useful occasionally, and I think it will continue. And so if you can get those families utilizing it, if it is available for them, I think that can be really valuable for them. And remember that families are the expert on their child, so we want them to share their unique knowledge to help with better outcomes everyone wins when that's the case. And advocating, we just heard about that, right? We all need to try and advocate. It doesn't have to be at the legislative level. It doesn't have to be where you talk to your legislature and you're up on the Hill. It can be in very small ways, but I think some of that happened in that meeting. Was already, you could see some little light bulbs going off that maybe we can start doing this just in a small scale within our own organization. And I heard, and I loved this, that care coordinators and care managers make their providers better providers, and they can be change agents. So that was pretty cool to hear. So recognize the power that you guys have. Talked a little bit about how families can advocate for themselves, to get their system in place for remembering that important information, engage their team, make sure they know who those are. Find their good people to help bounce ideas off of, and then just, finally, we need to be patient with each other because we're all human, we're all under stress, and if we can be, cognizant that we're all in it for that same desired best outcome for that child and that family, then we can get through these things for sure. Oh, and then we talked a little bit about some of the big things that would really help if they got fixed. So we've noted them here. We'll see if we can chip away at them a little bit. Sharing that important information, the most important information, with all the providers of care and the families. Make sure that all the electronic systems that are supposed to be doing this for us are compatible. We need more mental health providers. We need them integrated in ways that make them accessible. And we need more programs like the Comprehensive Care Clinic and the Prader-Willi Syndrome Clinic. Wow, wasn't that tremendous what has happened with the Prader-Willi Syndrome Clinic? That's just tremendous. And then, of course, more providers who can take on these young adults as they transition into adulthood. Yeah, so, all right. Well, so we want to let you know that our next meeting, again, will be here. We definitely want to thank the Utah Parent Center and Utah Family Voices so much for the time that we were able to spend in their building. I, for one, am going to miss it. This is really lovely, really lovely. But that pole in the center, I need that, that's it grounds me. So I, for one, will miss it. But I think this is going to be really nice, and we hope, be able to connect with a lot more folks this way in the farther reaches of Utah. So we look forward to that, and we'll continue to work on that. So yeah, we're still getting our system in place with regard to locations. I think the bulk of you here are probably going to just continue to come to this site. The other sites probably don't make sense for you. But for anyone else who can hear me, we would love to see you as well. We would love to take advantage of this setup. And it really sounds like USU is willing to work with us and make these rooms available to us. So we just need to make sure that we have an RSVP and that folks will take advantage of it, and we're not abusing this, as it were. So we'll work through our system of letting you know what sites are available and working with those RSVPs. But our next meeting is May 16th, and for those of you in this room, we'll expect that you can come back to this room again. So, all right.
Can I just, a couple things. So during this meeting, our friends from Richfield said, hey, when is that UCCCN meeting? So I think next month we'll have some of our compadres in Richfield logging on for this. Second thing, I just got emails that positions for our traveling clinics have been approved through Department of Health. So we will be looking to hire very part-time OT, PT, speech pathologist, and audiologist to do approximately 22 traveling clinics per year. In the rural, local health districts, but rural areas. We'll also be hiring a full-time pediatric psychologist and nurse practitioner to do some developmental evaluations. They will be housed out of our Health Clinics of Utah sites 3 days a week in Salt Lake, 1 day a week in Ogden, 1 day a week in Provo. Wow. And on the weeks that we go to those 22 times a year that we go to those traveling clinics, the nurse practitioner and the psychologist will be our providers for those clinics as well.
Oh my gosh, that's exciting.
So as Everything state government takes forever to happen. Hey, Kristen. Thumbs up on that. As everything in state government takes forever to happen, we now enter into the HR phase of this to try to get these things posted. I really anticipate that the nurse practitioner and the pediatric psychologist could probably be posted publicly within the next week. We would leave that up for a 14-day recruitment, at which time we would then qualify candidates for interviews. So hopefully, next operative word, hopefully within the next month, we will have folks on board so we can start carrying out this agenda we have created to provide services.
Excellent.
For our kids with special health care needs.
Okay. Our fingers are crossed. That's great news. Okay. All right. Okay. That's it. We'll wrap up and grab another something to munch on as you leave, and we'll see you next month.
Thank you.
Thanks, Kristen. See ya.